The following program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.
Thanks for tuning in to Let's Talk Beauty. I'm your host, Sharon, owner of Green Envy Salon. And I have back with me today Dr. Jerrilyn Sullivan of Main St Wellness Chiropractic. And she also brought a little guest with her today. We have lots to talk about.
Yes, we do. Yeah.
But before we get started on that, how's it going?
It's going great. How's it going with you?
Oh my goodness, I can't let anything out of the bag yet, but a lot of good things are happening.
Good.
2017 so far is looking pretty good.
That's great. Good for us, too.
Yeah.
Big news this year.
Yeah,
Yes.
big news coming, but we get to share your big news. Mine, hopefully, the next episode, we can share my good news. So we'll see what happens. So let's introduce your guest that you brought with you today.
So this is Dr. Brett Ashenfelter, and she's a doctor of physical therapy.
Okay.
And Oak Physical Therapy. And one of the exciting things for our practice is last time I was on your show, I brought Dr. Brian Bigelow. He's going to be joining the practice.
Mm-hmm.
And so in the last couple of months, Oak Physical Therapy has joined our practice.
Wow,
which is huge and exciting for me.
Yeah.
Because I've been in practice for 25 years and I've referred out to other physical therapists for, different types of things. And I'm so excited to have two doctors of physical therapy working right in my building.
Yeah, that's awesome.
It's super. So, and they do one-on-one. So I can literally walk a patient to the front of the building where their office is, say, this is what's going on. They do an evaluation, and they work with that patient the entire time. And so it's part of our whole wellness approach. And they're working with senior citizens and children and pregnant women. And we've been working on this venture for over a year.
Yeah.
And so we've finally come together in a wellness partnership.
Right.
And we're really excited about this year working together.
That is exciting. Welcome to the show.
Thank you so much for having me.
And welcome to joining Dr. Sullivan at her wellness center over on Main Street. That's very exciting.
It is.
You must be exciting.
Very much so. And it's exciting to have Dr. Sullivan as well with her expertise and the fact that we can work with a chiropractor, because a lot of times, and we had talked about this before, a lot of times it seems like people choose physical therapy or chiropractic care and there isn't that synergy that there needs to be. And we can't do what chiropractors do.
Right.
And it's really exciting that we have that relationship where we're able to work together.
Yeah. So you started in October, correct?
Yes.
So you officially were on board in October.
Yes.
So that's exciting. Your patients must be like, this is awesome. The more you can offer your patients to stay in your own facility, the better off they are, because they don't have to get referred to go, somewhere else.
Well, and also I can just walk over and say, how's Mrs. Smith doing?
Yeah.
Or gee, you're going to see Mrs. Smith tomorrow, and I saw her today. And even though we can look at each other's notes on our software and see what's going on, it's still nice to be able to just walk over and tell her what's going on. And our patients so far, we've gotten very, very positive reviews, because they like the fact that we converse about them, that they can talk about us and talk about what we're recommending. Or the patient may say, well, Dr. Brett said this, and I say, I agree, and we've talked about it. So they know that we're talking about them and their needs, and it's not just going to another building to another building to another building.
Yeah, exactly.
So, yeah.
So what does that mean, like physical therapy? So is that just one standard word, physical therapy? Because you hear that all the time. Oh, my mom has to go to physical therapy. She got a hip replacement or whatever. Is it a standard term, or is there different types of physical therapy?
What I would say, I'm going to talk about chiropractic, and then I'll let Dr.
Yes.
Brett talk about physical therapy. And I agree, one of the things that she said is a lot of people think, well, you can do one or the other. They complement each other very well. So a patient may come into my office for, say, a car accident or a fall or a physical injury because they're training for competition, okay?
Yeah.
And so the bone is misaligned, it's putting pressure on the nerve, and I put those bones back into place, but the muscles are cranky. and they're not doing well. And so if the muscles are important to hold those bones in place, and if the muscular structure isn't functioning properly, then it's going to be hard for that person to hold their adjustment. And so the patient may say, well, there's some exercises they're doing, or is there something else going on here? And at that point, I'll say to the patient, listen, we've been adjusting you. You have something muscular going on here. So I'm going to refer you over to the physical therapist. You're going to go see one of the docs over there, and they're going to do specific things for you. I'm not a physical therapist. They're going to evaluate you, and they're going to be able to tell particular muscles that are functioning properly or dysfunctioning, and then they can correct that.
Okay.
And so I send them over to them. They do their evaluation, and then you can explain, and they explain what PT is, and to the patient, and the difference it is. So Dr. Brett can tell you exactly what physical therapy do, because there's a lot to it.
There is, and we have a lot of tools in our toolbox. When you say somebody's going to physical therapy, it could mean a lot of different things. There's physical therapy for neurological conditions like Parkinson's disease or Alzheimer's. There can be the musculoskeletal physical therapy, so that would be a lot more of the patients that we share, where maybe you've just had a pregnancy and you have your abdominal separation following that, and maybe you have back pain. Just a lot of different things that we treat with that. Also, there's the pediatric end of physical therapy, where we'll see children who maybe have torticollis, which is where you have the shortening of one of the muscles in your neck, and the head's held at an angle for really little babies. Or you also have some of the pediatric developmental programs where we just sort of help facilitate reaching the milestones, which helps the learning process. So it can be a lot of different things, and we can do anything from, we'll do some soft tissue mobilization techniques where it isn't the same as what Dr. Sullivan does, where we really realign the bones. It's more where we're working on the muscles around the joint and some of the soft tissue. We also have things like electrical stimulation we can do to stimulate the muscles, to also stimulate the response your body has to pain. That can be altered by some of they're called modalities. So things like electrical stimulation, or doing ice massage, using heat, just a lot of different things. So each patient's different, and what physical therapy could mean to someone might be very different for someone else, depending on.
I have a good question for you. So when I pulled out my back when I was working on my cafe, and I was walked into you, could barely walk. I was in so much pain. And you adjusted me, and in time that all worked out. And then I did the therapy on the bed with the heat.
Correct.
I always am doing you can do the hot or the cold.
Muscle stim, right.
Does that have anything to do with?
Well, some chiropractors use that modality, some don't. We both use that modality. It's a little bit more involved. So people hear of TENS and people hear of electrical muscle stim. So TENS and electrical muscle stim are the same thing in the sense that it puts an electrical charge into the muscle. You don't feel it. It feels great. It feels like little fingers massaging the area.
Yeah.
The purpose is to contract the muscle, fatigue the muscle, so it stops pulling unevenly. TENS does that. EMS, you can set it at different frequencies, which actually help the area heal. And so I use a very basic frequency. The doctor of physical therapy, they may use different frequencies or actually target one muscle in general.
Okay.
So they're more specific with the muscles. And it's not just the muscles. Of course, as a chiropractor, I'm musculoskeletal, and that's why I'm referring to them. But like the other day, I had a patient, he's an elderly gentleman, his back pain, he's doing great, and his balance was off. And I noticed it, I said, how long has your balance been off like that? Because I've been adjusting you, and it's not improving. So I sent them over to the physical therapist, and they did their evaluation, which is totally different than what I do. He was so excited. He came back. He goes, "Look, I'm balancing and I'm doing the exercises."
Nice.
And so we have a nice symbiotic relationship here. So it's not just the muscle skeletal type things. We had a little old lady, and she had to learn how to walk with a cane, and she was just having a horrible time with it. And I said, you know what? You need to go over and see the physical therapist. And they were able to adjust the cane, show how she'd walk, explain why she needed to do certain things. I don't, that's not my area of expertise,
Right.
you know, and I don't take the time to do that with the patient because it's not my area of expertise. So I'm very excited now that I have somebody I can send over to them.
Right. So are you by yourself in that?
No, I'm not actually. I have Dr. Charles Weiss is my business partner, and he works there as well. And it's really nice because that way we can also look at the patients that we book, and if we think one might work better with one of our personalities or one of our approaches, we can divvy up the workload that way. And
That makes perfect sense.
Yeah.
It does, yeah. We just had, the other day I had a little girl and she needed some work done, and I know she was kind of shy, and so I said, "Oh, I have the perfect doctor
Right.
for you." And look at, she's this tiny,
Yeah.
cute little
Yeah,
doctor,
yeah.
right? And
Yeah.
she's not intimidating to another little girl, whereas you know, Dr. Weiss is a man, you know,
Yeah.
and not that men are intimidating, but for a little girl, she could certainly relate more to the, you know, the mummy girly
Yeah,
figure, you know,
absolutely.
and
Right.
so it's really works. And there are some people that want a male doctor, and there's some people that want a female doctor.
And it's good because you have those options now with
Right.
him joining you by, I don't know what month you guys
He's
said
coming at the end of the summer is our goal with Dr.
Okay.
Bigelow, yes.
So
yeah.
you guys will have that nice contrast, you know, and the same with the physical therapy.
Right.
Now, how did you meet this other doctor?
we met a week before graduate school started.
Really?
And yes, and actually he used to go by the name Brett, and my first name's Brett, and so we hit it off, and we were lab partners through school, and
Yeah.
we worked together on thesis work and things like that, and so yeah, we
So this is exciting for the both of you to have this opportunity
very much so.
to come on board. That's great.
Yeah,
I'm all about opportunities.
exactly.
Absolutely.
Us too, yeah.
So hours of operation still the same?
We practice about the same hours because it's just easier for the
Yeah,
patients.
so you can
for
bring and vice versa.
evaluations.
Yep.
But you know, they're not confined by the hours I practice. You know, they're open to weekends and so forth as
Right.
as their practice grows, which I'm sure it will this year. Now that all the Medicare and now that
Yeah.
they have all their provider licenses.
And you had to do that for your practice too, right?
Years ago, yes,
yeah.
yes. So
Okay.
because they're into a new practice, they had to get all the new numbers, which is a pain. It's just paperwork.
A lot of
It's lots
paperwork. Oh, yeah.
paperwork.
Yeah.
I
And
know.
you're dealing with Medicare, which is
Yeah.
government.
Yes.
That's a whole
Special
nother show.
challenges.
That's a whole nother show.
For sure.
Yes.
For sure.
But so it's exciting. We work together, and it's nice. Our plan is to do a lot of wellness fairs and things, those type of things together, because we can both offer two different types of things, but work together with it. And you know, I don't know. I'm just very excited, like you, for 2017 with
Yeah.
Dr. Weiss and Dr. Ashenfelter and Dr. Bigelow coming
Yeah.
on. So
Yeah.
it's going to be a good
You're going to
year.
have my husband expand some grass area for
Yeah, actually,
parking.
I just talked to him about
Are you
that.
serious?
I did. I just said, Eric, I need to expand my parking
Yeah?
lot, and I got to take a tree
Is
out.
there
Yes.
room? Can
There's
you
a
do
little room.
A little
yeah,
room?
yeah. We have
even a couple
we
of
have enough.
spaces
just
for employee
just
parking
4
would be
spaces. Well, we
great.
don't even do we can't even do employee parking.
Oh, really?
Our practice is so busy right now. We're all parking on the side streets.
Oh, okay.
Yeah, because it's
as long as you have a side. Yeah, I'm trying to think.
yeah, over by the Salvation Army. We park over there. Well, we sometimes have, on a very busy day between their practice and my practice and the massage therapy, we might have 80 people come through that door.
Yeah.
So, not all at the same time. thank
Right.
goodness.
I'm like,
Thank goodness.
No,
more spaces is not going to
a little
cut
bit more.
it. We might need to do a second level
Right.
garage parking.
I need a parking garage. I might need a permit for that. I don't know. So it's a busy day. You know, we're very excited about all the things we're going to offer, and you know, one of the things that Dr. Ashenfelter should probably talk about is she's working with a lot of children and pregnant women, and
Yeah.
so I think that's something you should.
Well, it's really an underserved community because I was pregnant recently. I had my first daughter back in February, and I was surprised at how little information there was for pregnant women about what exercises are safe during pregnancy, about when you can start exercising again afterwards. And then, especially as I joined like the moms boards and things online, I started seeing a lot of moms talking about things like urinary incontinence, and a lot of people saying, well, that's normal, there's nothing you can do about it. And it's not normal, and it's not an acceptable part of life.
Yeah.
And it's something that a lot of people don't want to talk about, but there is a need for that rehabilitation and care after pregnancy as well as during pregnancy to help prevent some of these issues. And if you look at France, for example, the government, with their health care, pays for 21 sessions of physical therapy for every pregnant woman after she's given birth, before the doctor signs off and says, okay, you're good to resume normal activity. And that's really something we should be looking at here, is taking care of women who have given birth, because it's a natural part of life, but it's a traumatic experience on your body, you know? And you have abdominal separation, so the diastasis recti. You have changes to your pelvic floor that can come with stress incontinence when you jump or laugh, things like that. And then as well, you have all that relaxin in your body, which is the chemical that loosens your joints so that the baby is able to grow and your pelvis is able to expand. But that can also mean that you're a lot more prone to ankle sprains and injuries like that, as well as the fact that after you're pregnant, your gait changes for everybody. So if you were a runner before and you were running and that was your workout of choice, when you go back to it, you might have new aches and pains that you never had before. So trying to figure out what's going on. And then as well with pediatrics and children, I really found that there were a lot of people who, there is early intervention for a lot of people, and that's a wonderful program where you're able to get help for children who have developmental delays. But I talked to moms who didn't want to do that because they were afraid of their child being labeled, and then those labels following them into the school system once they started school. So I talked to a lot of moms about it, and they were really interested in programs that would tell them what they needed to do, how they could help their child from a physical therapy standpoint, while not necessarily being tied into some of those more governmental programs.
Now, what about is autism? Is that therapy? Autism and
Asperger's, or
I'm trying to think of the word. I can't think of it right now.
well, with autism and spectrum disorders, those are definitely something that physical therapists treat as well. And it's interesting, they don't know entirely why, but a lot of times, for example, autistic children exhibit what's called idiopathic toe walking, so they walk on their toes. And we don't know why that's common with autistic children, but it is. And so a lot of times you'll see these conditions that you don't think immediately they have anything to do with
you don't think there's something wrong,
exactly.
right? Yeah.
But there are a lot of things that physical therapists can do. Also, if you have developmental delays, like a child not reaching their milestones, those can be associated with autism or different diagnoses. And so a physical therapist comes in and can help them reach those milestones, which can also in turn help with developing speech, and help with their speech development.
So that was Down syndrome.
Down syndrome, yes, yeah, that as well. And there are physical manifestations with Down syndrome. For example, having lax ligaments in your neck, where you want to then train better head support and things like that, because those can be problems for children with Down syndrome as well.
Yep.
So, yeah, there are a lot of different things that.
So what would you, because I'm curious, for some reason as a chiropractor, I never thought of PT right after having children, of which I've had 7.
Right.
And she's about to have her second grandchild.
Yeah.
So what would you say to like a mother that's expecting soon after she has a baby? What type of things is that you say that should be addressed, whereas other people, other mothers or the older mothers, the grandmothers might say, oh, that's just normal, it's always going to be that way because you've had a baby.
Right.
And then when do you worry about it? At what point do you say, well, I'm still healing, it's 2 weeks or 3 weeks. So when do you worry about it at that point?
So I would say that it depends on the issue that you're talking about specifically, but one of the first things that comes to mind as far as not living with it is the urinary incontinence. And, for those first 6 weeks, your body really is in a healing in the healing process. But that goes on for 2 years following. So a lot of organizations are now putting out the guideline that ideally you don't get pregnant again for those 2 years while your body's healing. I would say that having the incontinence issue is one thing that you shouldn't accept. Having things like, I've seen women with back pain after their pregnancy, and they'll say, well, I'm carrying the baby or I'm holding the baby a lot, and so I think that that's why I'm having so much back pain. And yes, absolutely, that could be contributing to it, but one, you should address that and the postural ramifications that are causing that. And then also things like having just low tone in general after pregnancy, because women are reluctant to get back into exercise because their bodies have changed. Also having the post-pregnancy weight gain, and then not knowing what's safe to do as far as exercise. And that's why we also offer some personal training sessions with physical therapists that really focus on the therapeutic exercise portion and getting your body back into the shape that it was in.
Oh, that's nice.
Prior to.
Yeah. That's really helpful.
So what are you doing to advertise and kind of let people know that all these new things are happening? You said you're going to be doing some wellness things together in the future.
So we actually were just sitting down last week. We're going to be doing a lot of fairs, Of course, we do a lot of social media, Facebook and our websites and so forth. And
what type of fairs? Like, what do you mean?
We have the city puts on a health fair every year. There are different colleges and different corporations and so forth do wellness fairs for their employees.
So what, a college this is usually
held?
Yeah,
some of the colleges, they have like the Nashua Community College has had health fairs. Like I said, large corporations. We do stuff with the city. I just did a program with the firefighters. So we just try to get out into the community and try to do those things. She's going to try to do some, there's a lot of, right now, not in the wintertime, but a lot of races, and fundraisers, those type of things. So we just want to have a presence there so people know that they have these options. And, at our wellness center, we also have, my postdoctorate is in functional medicine. So we have the nutrition, we've got the exercise. So it's a great opportunity. We're not that we don't cater to the elite athlete, but we want the person who has had problems, and they're trying to get healthy. January is a great time, new year, new you. What do I have to do? Well, I'm not exercising. Why aren't you exercising? I have back pain. Okay, well, we got to fix that first before you do it. Is it a musculoskeletal problem, or is it something like Dr. Ashenfelter was talking that's been going on, and you're on your third baby, you know? All right, I want to lose weight. Well, what's a safe way to lose weight versus, the latest fad on the internet, for $4.99. So we're all trained. We have 3 doctors working there, and soon to be 4 doctors that have training in wellness, really. It's all about wellness, Of course, we diagnose and we say, here's the problem, but neither one of us, none of the doctors at work are going to prescribe you drugs. Our goal is to get to the root of the problem, whether it's through chiropractic, physical therapy, or combination of both, or nutrition, and that's what we're really, excited about. So there's a lot. We have a lot to offer.
Yeah, and it's good. You have email blasts, and like you said, the social media, and same with me. It's all about the computer systems that are great for your business that you can broaden your horizons, and get people to know what's going on.
Well, the internet is important. We were just voted best of survey for the Nashua region for chiropractic and wellness.
Awesome.
So we're very excited.
Now, how does that happen? How does that? Do you know?
It's a company that puts a survey out for the region, and then I guess it polls people through Google or whatever the case may be, and so people go on voluntarily, and they see it and they vote. So we're really excited about that. And but I'm including Oak Physical Therapy, and it's more for the wellness, the wellness that we offer.
So everything goes through the front desk. As it's been going on. Have you needed to add to your front desk?
Not yet, but I'm hoping that we have to. Actually, we're probably going to add in about 4 months. We need to hire somebody else.
Okay.
Yeah. So the patient will come in. They go to the front desk. They'll either go to the doctor of physical therapy, the doctor of chiropractic. Maybe they have a massage, or they're doing, a nutritional consult. But it's all right there.
Yeah.
And it's scheduled.
And that makes it easy.
Yes.
Yeah.
Yes. Much easier.
Yep.
And it's confusing a little bit now for our staff that's been there, because they're like, well, is this appointment for physical therapy? Is it for chiropractic? Is it for nutrition?
Yeah.
Is it for weight loss?
Right, right.
But that's a good headache.
Yeah,
that's
I know,
a good
right?
headache.
Good problem to have.
And I have great staff. They're smart women. They work great, and
Yep.
they do a great job. So we're very confident with our staff that we have.
Yeah, we couldn't be
at the
happier.
office.
Yeah, I mean, you
So.
have the flow going on. You're just kind of adding
Right.
to the, stairway of
Yes.
growth here.
Yes. Lots of growth. Yeah.
So what's the first event that you have planned? Do you know the first?
I don't know what we have coming up. I think we do a lot with Little Iguana. That's coming up.
Yep.
So he does a lot of children's festivals, which is great for Dr. Ashenfelter. And I see a lot of children in the practice, so we have that in common as well. And but I don't have any events as of yet. I don't know the actual dates. So next time I come on, I'll have to.
Well, I don't
tell
know.
you.
Is it going to be possible for us to do this triathlon thing?
Yeah. Do you want to do the triathlon? There's a Title IX, September. That gives us 9 months to train.
And that's swimming in water?
Yes.
What about the kayaking one?
We could do the kayaking one, yeah.
We're,
The
we're,
sounds
we're,
like fun.
The water's going to be cold.
we're
Just
learning all the skills that aren't theory for that, okay?
We just have to. If I sign up, I'll commit. I'll start training. That's what I've been waiting.
Because you haven't started training again
I
yet?
haven't started training yet. Yeah. Oh yeah.
Well, I have to say,
Yeah.
January has been kind of a bit of a flop because I was really sick and
You're right.
I had some
It was
things
just
going
stupid
on.
cold, yeah.
And I know that we're both going to be maybe busier
Right.
for a time period, but we still need to fit in
We
that.
can do it. We
Yeah.
can do it. Yeah, it's part of wellness, right?
I know, right? That would be awesome.
She's exercising, chasing her little baby around.
I know, right?
All the
We've
time.
been there, done that.
Yeah. Oh yeah, swim across the lake.
Yeah, oh my God. So where's the one in September?
It's in Massachusetts. It's a Title IX, which is all women.
Well, what is?
It's bike. It's a swim bike run.
Yeah.
Yeah.
Right.
So we can do it. We can do it. It'll be fun.
Well, my concern about doing something like that was I don't have time to train with the swimming thing. I have a pool in my house.
Yeah.
But it's a round pool, so I guess I can,
You're fine. You don't have to train as much for that. It's just doing the cardio.
Yeah.
You'll be fine.
Yeah, the cardio is no problem.
Yeah, you could do it.
Yeah.
Piece of cake.
Well, that's already going to be a wrap for our show today. Once again, it goes by so fast. Thank you for being a guest.
Thank
Hopefully
you. It
you'll
was a
come back
pleasure.
again, and
I'd
maybe
love to.
the other doctor will come on as well, and
Yes.
we can do this again.
That'll be great.
All right. Thanks for tuning in.
The preceding program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.